Hi, Regina.
Well, hello there, Sheri. How are you?
Good. How
It's
are you
good to
today?
see you.
Great to see you too. Hey, welcome back, everybody. We're just real happy to continually give these podcasts, provide some information, have a wonderful, rich discussion between us. We hope that all of you out there are having also rich discussions in between these podcasts. So I want to introduce myself. I'm Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we are here on behalf of a program brought to you by the Connecticut State Long-Term Care Ombudsman through a generous funding from the CARES Act.
Which is so fantastic. I believe that they really are investing in this topic, and it's necessary, it's timely, and we can actually do something. This is actionable. You know, it's not just the intention that they had, they really took action, and I really can appreciate that.
Right. It's certainly a mission and a vision that we can align ourselves with.
Absolutely.
Yeah.
Absolutely. And all of you, as you're viewing, you too can take action.
Oh, that's such a good point. And that's what we hope to impart in this podcast series.
Absolutely.
Everybody taking a responsibility and doing their part.
Sure,
Yeah.
sure. I mean, when we start thinking about all that has taken place, I mean, we have really, I call it the three Ps, you know, we've had protests, politics, and pandemics. And all of that has created separation of some type. Separation of, body and mind, heart and soul, communities, our nation. All of these have separated, and then we have our social distancing that has taken place.
It really has.
Yeah.
And that leads us right up into today's topic. Today we want to talk with all of you about the problem of isolation. This is something that has really impacted probably far more than many other Americans, but with long-term care residents and their families.
Sure.
Dealing with the chronicity of long-term isolation and what that means and the impact and the toll that takes on people when they are cut off.
Absolutely.
And in long-term care, isolation has always been a topic that researchers and people working in geriatrics in the field of geropsychology, we have always paid attention to isolation and loneliness.
Yes.
Knowing that when people are lonely, particularly when they're lonely, that can cause to increase prevalence of depression, of anxiety, when people are cut off, both by proximity or socially from the world, that it can lead to have very detrimental effects on a person's psychological well-being and their overall well-being. We've even seen researchers have been able to make links between isolation, loneliness, and chronic illness. Worsening cognition, and in the worst cases, suicidality has been brought up.
Absolutely. You and I had this discussion, and I really started thinking about my own mother, and I could always hear her say, "I'm so lonely. I'm so lonely." My grandmother used to say it as well. And at first I'm thinking, I'm busy, I've got things I've got to do, but when we stop and thinking about the impact of loneliness, we really have to start adjusting and thinking different ways and being unique about it. In addition to that, we have to start thinking about isolation and what does that mean culturally? That it is different for different people. And so we're going to be talking about culture and that layer that comes within isolation. We have isolation in general, but then we have those layers. More specifically, thinking about, say, if a person is used to being the matriarch of the family and always having people around them, and what do you do? Or the patriarchal person, or maybe it is that you have been that social butterfly. And now, not only have you aged, and with ageism comes a lot of separation in and of itself, But then now we have this pandemic that has created even more separation and isolation. And so those layers, what does a person who is used to being with people and used to interacting, what are they to do at this point? Or I think I would like to ask you is, what are some of those symptoms? What are some of the things that they go through? What are the challenges before we go into some of the skills and what we can do about it?
Yeah, thank you for asking that question. I think it's important to distinguish between two very important concepts here that are very different: being alone and loneliness.
Very much so.
Because people can be alone and not feel lonely.
Right.
And my mom is the perfect picture of this person. My mom has lived alone for, I'm going to guess, 35 years. And she is fine being alone, living alone with herself. But in this pandemic, she has talked more and more about the feeling of loneliness.
Yes.
Loneliness is a different concept in which a person feels cut off from. They feel that they're not a part of. It's being lonely, and we can feel, I don't know if you've had this experience, but feeling lonely even in a crowd.
Absolutely.
I can be in a room of people and feel completely lonely in that.
Yes, as a matter of fact, my mother is on the opposite end of your mother, because she's always around us, but she's always saying that she's lonely.
She's lonely.
But something that you said that I believe is key is that you said cut off.
Yes.
And so investigating that area, talk about that a little bit more in terms of feeling cut off and isolation and loneliness.
Right. Feeling cut off, well, that couldn't be more evident in long-term care. In long-term care, we're faced with this heart-wrenching tension between protecting a medically fragile community of people, older adults, protecting them from the virus while cutting them off from outside support and connection, which is vital to people's well-being. And so the cutting off is, that's what we're doing inadvertently by protecting people. And so there's this tension between those two things, because while we may be protecting a person, we're also cutting them off, and we might be causing more harm.
Yes.
And that has been really on the minds of the Ombudsman program, for example. Ombudsmen are the people who are given that wonderful task of being the advocate for residents. And they are the ones who help when a resident is feeling that loneliness.
Yes.
Working with the facility and with the families on what do we need to do differently to bring voice back to that person. Because what happens is when a person feels cut off, that leads to worse, reduced feelings or increased feelings of loneliness, but reduced feelings of self-worth.
Oh, yes.
Feelings of being invisible, not having a voice. And when people are oppressed that way, it can feel like oppression, going back into the shadows.
Yes.
They don't have a voice, and their voice doesn't matter.
Right.
And so we want to recognize that, knowing that can lead to poorer health conditions, that can lead to people dying prematurely of loneliness. People can die of a lonely heart.
Sure.
So I think understanding those distinctions of being alone and lonely and feeling cut off.
Absolutely.
And what do we need to do better to bring people out so that they're not cut off? And there's some wonderful ways that long-term care facilities are doing that during this pandemic, as they've had to become creative. So I've seen pictures of long-term care facilities now having, windowed or glass partitions that they move outside where people can have full view of each other.
Yes.
You might have seen the hug tunnels that have been created. So this is actually something that originated from a long-term care facility in our backyard in Longmont, Colorado. And somebody came up with this ingenious idea to have a plastic sheath that has arms built in. And so now somebody has replicated this into kind of these mobile things that people can put their arms in, and they can safely touch and hug one another. Doesn't that it really does give you goosebumps,
as soon as
right?
you said it, there's something about a hug.
Right.
And it's so important that we start to realize that importance of that you can be creative.
Yes.
And you can do these things. I go back to, just people feeling isolated and lonely. Think about this culturally for a moment. Think about this. There are people who have come to this country that feel all alone.
Right.
Because either they don't speak the language, and so, they've been isolated and they had to work through that. And that's traumatic in and of itself. And then you have to go back. And now that you have a momentum, and we fall into this pandemic.
Right.
And now it's there again, and it gives that anxiety, like, I'm there again. What am I supposed to do? I don't feel comfortable. I'm worried. Or maybe it is that you've come from another country, and just your mere presence, you are cut off, not socially accepted by the larger community. Right. And so trying to navigate your way through all of that. I mean, just think if you wore some type of headdressing, or you have a ritual of prayer, or it is the way that you speak your language, or the way that you approach anything. Right. Your experiences sometimes cut you off from other areas. Right. This can become very painful. So now you have that, and then you couple it with this isolation. Yes. Even in long-term care, there are people there that are not socially connected with the other groups. Like if you're an introvert and everybody else are extroverts, right, then you're cut off. Or if you are a different race or ethnicity and you're the only one, or maybe there's one other, then sometimes that can be cut off as well. Right.
And I'm also thinking about residents in long-term care with different sexual identity.
Yes.
Our LGBTQ older adults. And we've always known this about that particular group of people who move into long-term care and unfortunately may have been living their lives out of the closet, as we would say.
Right, sure.
And then having to go back in the closet because long-term care communities, we still struggle around that, about being accepting of that group of people.
Right.
So you have, even within that matrix, a person's sexual identity and feeling alone and lonely, and then being cut off because of the pandemic even more, right? And not being recognized for their differences.
Absolutely. And that recognition, recognize me. Do you see me? People want to be seen. When they're in isolation, it's like wondering, when am I going to see someone again? Right. When am I going to have that conversation? Is this it? Is this where I tap out and I'm done? We have to stop and think about those impacts and what can we do about it? Thinking about how can we bring consistency back into the lives of those who feel so isolated and so alone.
Absolutely. And I find this through talking with my mom. You and I've shared a lot about our parents. Yes. And my mom is a very social person. And one of the ways that she has combated her loneliness is that she continues to tap into her altruism. Altruism is a way that so many of us can find connection. When we give to someone else, it is our way of not being lonely.
Love it.
And the way my mom does this is my mom bakes chocolate chip cookies. I brought you a plate of them today.
Yes, you did.
And our cameraman.
Thanks, Mom.
Thanks, Mom. And my mom is known for baking cookies in the community. And so what she'll do is she leaves them on the porch, and people come and get them from her porch, and they wave through the window. And it's a way that my mom feels a part of the community that continues to give back in an altruistic way. Mm-hmm. And I invite our listeners out there and our caregivers finding ways to tap into the altruism, ways that we can give back through the littlest of things.
Absolutely.
That can kind of draw us out of a place of loneliness.
Absolutely. I believe that I've seen more people who have expressed that today making these masks. So there was a woman, older woman, who she knows every time that I'm presenting, I'm on camera, I'm in a classroom, I'm somewhere, I'm always wearing some type of outfit and trying to coordinate. And she went through, saw different pictures of me and made a mask for the different outfits.
Isn't that?
And I says, I have to pay you. She says, I'm already being paid just for the mere fact of you taking this gift from me. And so that was very altruistic. That is what it's all about. And I bet you she felt as good, if not better, than I did when she gave it to me.
Right. I'll bet she did.
Yes.
Yes. Absolutely. You know, thinking about what are the creative ways, again, going back to that we've had to combat loneliness or try to. Because what we want to do here in this podcast, as we've been doing, is focusing and highlighting on the strengths. Right, of people. Sure. While recognizing that all of this has had a trauma impact. That we might be reliving traumatic times. People feel lonely in their childhood, may have had lonely experiences of being bullied, for example, being set apart from their peers and their classmates. And recognizing as care providers and as family members, if your loved one or your care recipient is reliving some of that through this cutting off of isolation and the loneliness that can come from that, and recognizing that they might be reliving some of those earlier traumatic experiences is really important. And so we want to be sensitive to that and know that when a person interacts with us in a way that may be angry, it may be irritability, it may be crying, that is an expression of something else that's going on. And so sometimes it's through behavior for some people when they can't articulate what's really at the root of it, that the behavior is communicating to us that they are struggling. Yes,
really paying attention to that body language is really important. There's things also that we could do, music. Music brings in memory. Music brings in calmness, happiness. There's so much to music that can be played. Media, watching movies, being able to remember when. So we had talked about in another podcast about, watching movies from way back or television shows like Gunsmoke, just looking at that, because what happens is we start watching, we can actually see the frame of the television screen. But once you get so engrossed in it and you do true listening, that disappears and you become part of that. And it takes up, some time, anywhere from an hour to 2 hours, 3 hours of time that can also be spent when no one can actually be there. So just thinking about that, or sharing memories, asking, as a somebody who is a healthcare provider, you could actually ask questions. Tell me what it was like when you were a young girl, or what did you do when, and let them fill in the blanks.
Right. Absolutely. And in fact, I want to highlight something that you've just said here about asking those questions. Sure. In psychology, we refer to that as reminiscence therapy. We do reminiscence therapy, or we do like life review. Nice. Talking about earlier memories and drawing out those stories that could inform people about how they get through this particular time. But I also want to direct our viewers to some important resources that are available to you to use with your loved ones. The National Consumer Voice and the National Ombudsman Resource Center have some wonderful resources available to you. They've got a great activity booklet that I have used with some of my clients, family members of loved ones living in long-term care. It's an activity book, and what I love about it is that it has those questions that encourage connection between families and their loved ones in long-term care. It also has a lot of other really great activities in this book. That it's free. You can download it. Part of the national conversation that ombudsmen have been having, their tagline, if you will, is connection matters.
Oh, I love that.
And that's really what we're trying to promote here in this podcast around isolation. Connection matters, and that healing happens in relationship.
Oh, I love that you said that too. Healing happens in relationships. Yeah. That's absolute relationships of mutual respect. Right. Because you said that they could download it. Could you tell them how to download?
Right. So you want to go to, I believe it's norc.org, or you can Google National Consumer Voice or the National Ombudsman Resource Center and go straight to their website. And you will find resources for families on that website. And if you go down, you'll find an activity book. Nice. There's lots of different things. There's tip sheets for families. There's ways of how to, check in with your local ombudsman. Mm-hmm. Of course, this podcast is supported by Connecticut State Long-Term Care Ombudsman. Sure. And each city within the state of Connecticut will have a regional ombudsman that they can contact and get more information.
I think that's beautiful. So, I was talking about, playing music and memories and asking the questions. You can even have photos that individuals could look at, sharing that information. But what about when there isn't anyone around?
Right.
What can you do? Is there any way that you can call somebody? Is there?
Yes.
Can you make a photo album for people?
Right. Well, there is a phone number. This is really interesting. There's a special organization called, it's offered by the Institute on Aging, and this is called the Friendship Line. Oh. It's a 24/7 line that older adults over the age of 60 can use. It's 24/7, toll free. I'm going to read it twice so that people can write it down.
Nice.
It's 1-800-971-0016. 1-800-971-0016.
So what can they expect? If they call this number, what can they actually expect?
So they can expect that they have volunteers who are who specialize in having conversations with older adults, particularly around some difficult topics such as having some depression, for example, or some anxiety. And I will also say to our listeners out there, they're looking for volunteers.
Oh, wow.
So if you yourself are looking to be altruistic and to give back to older adults in our across our nation, you can also volunteer as one of these people on the Friendship Line and offer support and just some reassurance. And that's really what I think this Friendship Line does. They offer reassurance, they offer some skills, they talk to the individual. And I think they're also kind of assessing if that person needs more help than what is maybe on the surface. Maybe they need to speak to a mental health counselor themselves, and kind of assessing that.
I think that's wonderful. I think another thing that you could do is maintaining rituals or helping them to maintain rituals. Some people like to have family dinners like on Sundays. To keep that open, you could still do it virtually. Something that I've always enjoyed, there's something about bragging rights of your best food, like macaroni and cheese, which is not really supposed to be good for you, right? Or how you prepare your turkey. How neat that would be to actually have dinner together and to be able to show on the video, look, this turkey comes from your recipe.
Oh, isn't
You know what I
that
mean?
neat?
And
Yes.
be able to share how that turned out.
Yes.
Or asking the question, I'm in the kitchen. I'm trying to prepare this dish. Can you tell me? I remember calling my grandmother when she was living. We called her Sugar Pie. And I said, Sugar Pie, could you tell me how to make your candy sweet potatoes? And she'd say, you've already called me. I know you know how to make them. And I says, oh no, they never turn out right unless you tell me. To really show that that person is still valued.
Yes.
And to go through that. And if she was living today, I would have the camera up and say, listen, I know you got some time. Watch me as I go through this. And she would probably say, no, you need to get another, scoop of this and some of that in there. That's really important.
Right. And that's a wonderful idea.
Mm-hmm.
Ways that we can bring out the expertise.
Yes.
And that people can feel like they have meaning, right? And that they are valued.
Yes.
A part of the community, whether that's your family or the community there in long-term care.
Yes, absolutely.
Yeah,
This is so fantastic.
That's great. I was just poring over my other things that maybe people could, also some resources that they can that's available to you. I already talked about the National Ombudsman Resource Center, a wonderful place to get information. You might also consider, if for those of you who have loved ones in long-term care, if you find you know your loved one better than anybody, and if you see that that person is struggling, if they are talking about death more, or let's say they are crying more, or maybe they're not talking as much, or they don't want to talk on the phone as much as they did, use that know that that might be a red flag. Know that that could be a symptom of something worse that might be brewing for them. And let the long-term care nurse or the administrator know that this is what you're experiencing with your loved one, and see if they have behavioral health or mental health services available that could talk to your loved one. Try to get them some support.
Nice.
Now that a lot of long-term care facilities or communities across the country are starting to let even healthcare providers back into these communities, behavioral health and mental health services, I think, are going to be more and more utilized. So please bring that up. I also want to say something about language. You and I talk a lot about the importance of language.
Yes.
And our words mean something.
Yes.
Earlier on, when the pandemic happened, a group of psychologists came together and made and wrote a paper about how the country could go about in messaging to our nation about this pandemic. Mm-hmm. And one of the recommendations that unfortunately didn't stick, but I think is worth saying here, is that the recommendation is that we refer to our safety precautions as physical distancing, not social distancing.
Yes. Yes.
And, because that has real life, real world implications. When we say social distancing, it almost implies that we are cutting ourselves off socially, thus emotionally, maybe even spiritually. And so changing our language around physical distancing, because it's the physical distance that protects us right from the virus, not social. It's
social is what keeps us mentally, spiritually, and emotionally together.
Intact.
Yes.
Right. And so I think just bringing that language back into our conversation about when we use that kind of language, it does have implications. And again, going back to the intent was to keep people safe, and we didn't know that the long-term consequence was that people would feel cut off and they would act and behave in ways that maybe weren't helpful to their overall well-being.
Absolutely. I have to agree with that. This has been fantastic. I believe that we have shared some information that would be helpful for our audience today. Yeah. Real tangible. I mean, when I first started this conversation with you, it was a little somber, but listening to it and seeing that there are things that you could actually do is really exciting. I hope that you got that out of this conversation today, and that you'll take it further than just this short time that we have together, but you take it home to your family, your friends, and those who you care for, and for caring for yourself.
Oh, great point. I couldn't have said it better, folks. Thank you so much for joining us today, and we look forward to the next time. Keep the conversations going. Keep your creativity flowing so that you can really continue to connect.
That's fantastic.
Thanks.
Bye for now.
Bye.